Welcome to your weekly wellness dose, The Wellness Factor. I am your host, Dr. Noelle, and today we are discussing weight loss medications. I'm sure you've heard of a few: Ozempic, Wegovy, Mounjaro, Zepbound. These are medications that fall into the class of meds known as GLP1s, so glucagon-like peptide agonists. Could these meds be the new wonder drugs? Well, we're going to discuss that today. Now, I have to say that in my almost 20 years of practicing medicine, I have never really been fond of weight loss medications. In fact, I typically did not prescribe weight loss medications. However, with the availability of these medications and the constant data that is showing benefit, not just in weight and blood sugar control, but also in heart disease prevention and other chronic conditions, working as a preventative measure, not just a treatment measure, I have changed my thinking and approach. And in terms of weight loss success, I have seen tremendous positive outcomes for my patients with these medicines. It is always a three-pronged approach. Okay, so nutrition, exercise, medical therapy, with having all three on board, typically resulting in pretty great outcomes. So let's discuss, how do these drugs work? Semaglutide, also known as Ozempic or Wegovy. It is a GLP-1 agonist, a peptide, a sequence of amino acids, which mimics the hormone glucagon-like peptide, GLP-1. When it binds to the GLP-1 receptor, this triggers release of insulin, hence decrease in blood sugar. But it also works to decrease appetite, early satiety or feeling of fullness, slows down gastric emptying, the time it takes for food to move along the digestive tract, and perhaps also decreases inflammation, hence its impact on decreasing cardiovascular risk, which studies have noted, and perhaps also playing a role in weight loss and improved metabolism. So tirzepatide, also known as Mounjaro or Zepbound, binds to two different receptors, so essentially offering dual therapy. GLP, the glucagon-like peptide receptor, which works to decrease appetite, slows gastric emptying, increasing insulin release, but also GIP, glucose-dependent insulinotropic polypeptide receptor, which works to decrease appetite and increase energy expenditure. Now, it has been suggested that tirzepatide is more effective than semaglutide as it works on two different receptors, and early studies have shown a slightly higher amount of weight loss and better blood sugar control with tirzepatide. However, these studies did not compare head-to-head with the higher dose of semaglutide, the 2 milligram dose, which was not available at the time of the study. So there is more data that needs to be analyzed to say that one is truly far superior than the other. So now that we've discussed how these drugs work, what should you expect when taking these medicines? Well, it's given as a subcutaneous injection once weekly, so injection underneath the skin, starting at a low dose and titrating up typically after 4 doses, once a month as tolerable to the next dose, eventually getting to maintenance dose, which takes about 4 to 6 titrations. One should expect to see about a 2 to 5 pound weight loss monthly. No, it is not a fast or rapid weight loss, at a slow process, and we don't want a rapid weight loss, as that may increase your risk for having adverse reactions and outcomes. Slow and steady wins the race. So most tend to lose about 5 to 25% of their total body weight while on these medications. Now, let's talk about side effects. And so typically the side effects that we see are gastrointestinal, including nausea, vomiting, diarrhea, constipation, perhaps hair loss, not seen frequently, but has been noted and can occur when there's rapid weight loss. Perhaps drops in mood or depression can also be a potential side effect. So something to look out for when you're on these medications. Now, adverse reactions, less common but possible, include intestinal obstruction. So this is a medical emergency, and that's where you are unable to pass gas or stool and have perhaps severe abdominal pain. If this occurs, go straight to the ER for evaluation. Pancreatitis, so inflammation of the pancreas could occur. Gallbladder disease, so gallstone formation or gallbladder inflammation could potentially happen while on these medicines. Let's discuss contraindications. Who cannot take these medicines? That would include pregnant women or those breastfeeding. If you're pregnant or breastfeeding, you cannot take this medicine. However, those planning for pregnancy and maybe need weight loss to improve fertility, this may be an option, and we'll talk about that a bit more in just a moment. Those who have a prior history of pancreatitis, those who have a family history of medullary thyroid cancer or multiple endocrine neoplasia, which are rare conditions, but for these individuals, not candidates for this drug. So who are candidates for this treatment? Well, Ozempic and Mounjaro are FDA approved for type 2 diabetes management. Wegovy, Zepbound are FDA approved for weight management. So, in terms of insurance coverage, the diagnosis matters. Typically, Ozempic and Mounjaro is only approved for those with type 2 diabetes, whereas Wegovy and Zepbound are generally covered for those who are overweight or obese with specific parameters. Okay, so those who are obese or morbidly obese, meaning that you have a BMI of 30 or greater and have failed behavior modifications, meaning able to lose more than 5% of their body weight over a 3 to 6 month period. If this is present, then it may be covered under your plan if you have coverage for weight loss medications. If you are overweight, with a BMI of 27 to 29, with at least one weight related condition, including heart disease, high blood pressure, high cholesterol, you could also be covered under plan for these weight loss meds. Now, there is another group that I have also treated. Those perhaps who are slightly overweight, maybe a BMI of 25, that need to lose about 15 to 20 pounds and have come to a plateau or halt in their weight loss and need a bit of a boost. In this case, microdosing with semaglutide or tirzepatide could be used as an adjunct to diet and exercise, either giving at lower doses or extending the time in between doses. And this is usually a situation where, of course, insurance doesn't cover, so there could be an out of pocket cost. But remember, this is not a magic potion. Behavioral changes are still required to reach optimal goals. So you must make sure that at hand you have proper nutrition, eating small meals, limited processed foods, sugary foods, fatty foods, regular consistent exercises on board, at least 3 hours a week of cardiovascular activity, considering a high protein diet. That means that you're consuming about 30 to 40 grams of protein per meal per day. Weight training, resistance training, at least 2 to 3 times a week, as there could be muscle loss that occurs along with the weight loss with these meds. And with that said, let's talk about Ozempic butt, Ozempic face, as this can happen when there is muscle loss. So, significant muscle loss can occur with the use of GLP-1 medications. And clinical trials have shown that people taking GLP-1 medicines can have approximately 25 to 40% of the weight loss due to loss of lean muscle mass. And when this occurs, this can lead to many things such as lower bone density, lower resting metabolic rate. Loss of lean muscle mass increases chance for rebound weight gain that we don't want. It could also cause decreased strength, mobility, agility, balance. But there are ways to combat this, right? So high protein diet, as I mentioned previously, weight training at least 2 to 3 times a week, M-Sculpt and Mcella, which I use often in my practice. So these are devices utilizing high-FEM technology, so electromagnetic energy to build muscle and prevent muscle loss during the weight loss journey, focusing on the core, including the pelvic floor, as the body does not discriminate where muscle loss occurs. So the pelvic floor is necessary for bladder control and sexual health and should not be neglected. The GLP-1s have a mild diuretic effect. So you may find yourself going to the bathroom more frequently, and having a strong pelvic floor is certainly needed to support the bladder and limit potential accidents and nuisance that can come along with increased urinary frequency while on these meds. Utilizing technology such as the Sculpt and Mcella can be an adjunct during your weight loss journey and yield perhaps more optimal results and make the journey a little bit easier for you. So, now let's talk about some of the other potential benefits of GLP-1 medications, how these could perhaps be the wonder drugs. First, dealing with cardiovascular disease. Now, there's much promise that has been shown so far with GLP-1s and cardiovascular disease. The SELECT trial found semaglutide consistently reduced major adverse cardiovascular events by about 20% among patients with prior cardiovascular disease and who were overweight and obese. The STEP heart failure trial also found multiple improvements among patients with obesity-related heart failure. It is thought that the GLP-1 mechanisms have a direct impact on blood vessels, improving blood pressure and lipid profiles. And I can say anecdotally that for my patients that I've started on GLP-1 meds, cholesterol levels have improved after being on the medications for several months. Now, disordered eating and addictive behaviors, another area showing promise, which I have also noticed in my practice. are the effects of GLP-1s on disordered eating, particularly with binge eating disorder. So, in a number of my patients, I've started on a GLP-1 for weight management who happen to have binge eating disorder concurrently. It did dramatically impact the frequency of their binge eating episodes to the point where I've been able to, in some cases, stop meds that were previously prescribed for binge eating disorder and continue the patient solely on a GLP-1, essentially killing two birds with one stone, aiding with weight loss as well as abnormal eating behaviors, essentially working to drive down the food cravings. And as some would describe, the food noise that was no longer prevalent. They were no longer obsessing over food or feeling controlled by food while on this medicine, which makes sense as one of the mechanisms of the GLP-1s is to bind to receptors in the brain that impact appetite and essentially the reward system that exists, decreasing the drive for food and perhaps other things, as there have been some initial studies looking at their impact on eating behaviors and addictive behaviors. Semaglutide in particular has been found to reduce overeating behaviors, food cravings, and preference for high-fat, high-calorie foods. Based on functional MRI studies, GLP-1 drugs appear to decrease the activation of the brain reward centers, which can impact or reduce addictive behaviors in many aspects. And there's been several studies worldwide noting thus far positive impacts on behavioral and psychological outcomes when it comes to addictive behaviors, including declines in alcohol abuse, smoking, opiate use, gambling, shopping, as well as lowering risk for suicidal thoughts and attempts with those on GLP-1s. Fertility is another area of promise for GLP-1 use. Now, understand, GLP-1s, such as semaglutide, are not intended to be a fertility drug, but the weight loss achieved with these medicines could improve fertility. So, weight loss for those who are overweight or obese can dramatically improve fertility outcomes for those looking to conceive, whether you do it through diet and exercise alone or with the use of meds. It is thought that semaglutide, however, in addition to aiding with weight loss, may improve menstrual regularity and ovarian function, as well as decrease androgen levels, so male type sex hormones, which could then impact overall fertility and ovulation. Again, this is not a medicine to take while pregnant or breastfeeding. And if you are looking to conceive, the drug should be stopped at least 2 months prior to trying for pregnancy. So now, in addition to all of the things we have discussed outside of weight loss and blood sugar control, there are several other areas that GLP-1s are showing potential. And I am sure more data to support its effects in the near future, including use of prevention for Alzheimer's dementia, treating inflammatory arthritis such as psoriatic arthritis, treating PCOS, polycystic ovarian syndrome, treatment of addiction disorders. So I will keep you posted as more data is released. Overall, I would say GLP-1 medications can be used as an effective tool in the weight loss process as well as for blood sugar control and perhaps many other things. However, there are not without potential side effect or risk, and every individual must weigh the risk versus benefit with your clinician to determine if this is the best route for you. I hope this helps and gives you some clarity. And with that said, it is time for our mantra of the day. So close your eyes. Allow your belly to be soft. As you inhale, the belly rises. As you exhale, the belly falls. Clarity. I am open to clarity, to clearing my path and releasing all things that no longer serve me. I accept guidance. I accept protection. Open to possibilities, seen and unseen. I am now clear on my direction. I have clarity. Now you can continue with that thought. You can continue with that breath, or perhaps you've had enough for today. I thank you for listening, and I pray your day is blessed and protected. Namaste.